Pakistan. Manaza, can you please share with us some of your reflections working in eye care in Pakistan?
Sorry. Thanks, Jennifer. Hello, good morning, good afternoon, and good evening, whichever time zone you are watching from. I'm very honored to be part of this esteemed group of panelists and great audience to share some updates from Pakistan on integration of eye care within the 𝗗𝗄𝗟 strategies. Overall, in the last 2 decades, there have been some significant improvements in Pakistan health sector. But at the same time, we are lagging behind on many fronts for different milestones and targets. And I reckon you would all agree with me that in such a situation, in a developing country like Pakistan, where there are so many competing priorities to deal with other life-threatening diseases burden, it requires very strong evidence and continuous advocacy efforts to create a space for eye care within the 𝗗𝗄𝗟 strategies. But thanks to our implementing partners, Ministry of Health and members of the National Eye Health Committee, peer eye NGOs, CBM, FHF, Brian Holden Foundation, who have been really instrumental in the driving force on the advocacy front. For achieving the target set for universal health coverage, the current government has launched the first ever flagship social health protection initiative called 𝗗cieះsais𝗁𝗶𝗵, which is currently being rolled out in 2 provinces of Pakistan. And the overall aim or goal of the program is to improve the health status of the population, to improve access to quality health services, and to reduce the poverty through minimizing out-of-pocket health expenses. The basic benefit package includes the secondary and tertiary hospital-based care services, which amounts around 1 million Pakistani rupees per household per year. And we anticipate that in the first phase, health insurance is going to be provided to around 15 million poor families living below the poverty line. I must mention here that initially all the eye care treatments were not covered by this health insurance scheme, but with the continuous advocacy of all the stakeholders through different platforms of National Eye Health Committee, partner hospitals, and national and provincial programs for prevention of blindness, these are all now covered by this insurance scheme. Let me mention some other key developments during 2020 and 21 for the eye care integration towards 𝗗𝗄𝗟. The development of 5 years integrated people-centered eye care plans with package of eye care interventions just mentioned by the earlier speaker at national and provincial levels in complete alignment with the WHO's framework on integrated people-centered services and the priorities of World Report on Vision. These 5 years Pakistan plans from 2020 to 25 are actually the midterm strategic plans designed to contribute towards a 10 years long-term perspective outlook to achieve the universal health coverage by 2030. The Inclusive Eye Health Task Force established under the National Eye Health Committee has been really instrumental for promoting the inclusive programming and integration within the optometry training curriculum, which has the capacity to be replicated in all the optometry schools. The inclusive eye health programs initially piloted and implemented by site savers in partnership with the public sector hospitals and very renowned charity hospitals, LRBT, has created a very strong evidence to address barriers for universal health coverage, especially for improving access of quality eye care by people with disabilities. So I'm very conscious of time. So that was a brief snapshot of updates on inclusive, equitable eye health delivery and programming in Pakistan. And we believe this is making strong strides towards eye care integration within the universal health coverage. Thank you.